Hey,
Morning.
welcome.
How are you doing?
All right, all assembled? Okay, at last month's staff meeting, we watched a patient safety video and we discussed some stories of patient harm. We also introduced the Comprehensive Unit-Based Safety Program's staff safety assessment form to the staff, and we asked them to fill it out in order to identify patient risks in our unit. So here's some of the responses that we've received so far. 3 of our nurses and 2 of our unit clerks have shared the same concerns. So I'd just like to read the ideas out loud and make sure that we're capturing your thoughts correctly and then categorize them. So several of you are concerned about our immediate post-op patients being at risk for falls, and some of you are worried about the number of patients that we're seeing with post-op infections, and even noted that there seems to be a number of patients who needed to be readmitted to our floor because of them.
Well, related to infections, we seem to be having an ongoing problem with antibiotic use beyond the recommended time frame of 24 hours post-op. And we all know that this could increase the risk for the development of antibiotic-resistant organisms.
Yes, it could. Okay. Another concern is that pharmacological venous thromboembolism, or VTE prophylaxis, is not being ordered post-op. And we have had 2 patients in the last 3 months who developed a clot that delayed their recovery.
Marie, we talked about that in our last medical staff meeting. Some surgeons do not agree with the recommendation for pharmacological prophylaxis. Let's table that issue for now.
All right, Sean. Now, several nurses were worried that we've had some admissions during shift changes over the past couple of weeks, and the clerks were concerned about this too. One of our newer nurses said she had an admission just before shift change last week, and it was really hectic. She felt as if she had forgotten to pass on some important information, and we all know that poor handoffs can lead to a lot of problems.
Yes, and I wonder if poor handoffs are the reasons for some other concerns I've had with antibiotics. We've seen several doses that were not given at the appropriate time.
These are all concerns we need to pay attention to, and I think they should be added to our CUSP Status of Safety Issues worksheet. There's a team working on falls. I'm working with a surgical committee to address compliance with the pharmacological VTE prophylaxis. So let's focus on how we use antibiotics, including stopping them as appropriate.
I agree, but I would like to recommend that we put handoff communication at the top of our list too. There appears to be a lot of patient information that's not being communicated from one nurse to another.
I hear you. We may find that handoff communication is the cause of several of the defects we are experiencing. Let's start with antibiotics, and we may end up with handoff communications as a contributing factor.
Okay, sounds good. So discontinuation of antibiotics 24 hours past surgery really is a concern. So let's talk about this more at our Learning from Defects meeting.